What is an Arbor staging for follicular lymphoma? Imagine trying to understand how, for a disease has spread in the body. That's what the Ann Arbor staging system helps doctors do for follicular lymphoma. It's a way to classify the extent of the disease based on where the cancerous lymphatic tissue is located and whether it has spread beyond the lymph nodes. This system is widely used because it provides a clear picture of how advanced the lymphoma is, which helps guide treatment options and gives an idea of prognosis. In stage 1, the lymphoma is limited to a single lymph node region or a single extralymphatic site, like an organ outside the lymphatic system. Think of it as a small, localized problem. When the disease reaches stage 2, it involves 2 or more lymph node regions on the same side of the diaphragm, which is the muscle that separates the chest from the abdomen. It might also include a nearby organ that's directly connected to the affected lymph nodes. Moving to stage 3, the lymphoma has spread to lymph node regions on both sides of the diaphragm. This indicates a more widespread disease. It might also involve the spleen or nearby extranodal sites, like tissues close to lymph nodes. When the disease reaches stage 4, it's considered advanced. The lymphoma has spread beyond the lymph nodes to other organs such as the bone marrow, liver, or lungs. This dissemination shows a more aggressive or widespread disease process. The staging system also considers symptoms like fever, night sweats, and significant weight loss, known as B symptoms. These symptoms can influence how doctors approach treatment and help predict outcomes. It's important to note that follicular lymphoma often involves multiple lymph node regions and can involve the bone marrow without necessarily indicating a worse immediate outlook. Because of this, doctors sometimes use additional classifications, like the Lugano system, which refine the staging to include factors like tumor size and whether the disease is bulky or not. Understanding the stage helps doctors decide on the best treatment plan. Early stages might be managed with less aggressive therapies, while more advanced stages could require more intensive treatment. The goal is always to tailor care to the individual's specific situation. In summary, the Ann Arbor system classifies follicular lymphoma based on how many lymph node regions are affected and whether the disease has spread to other organs. It ranges from localized disease to widespread dissemination. While it provides a useful framework, doctors often use additional tools to get a complete picture of the disease's behavior. Always remember, each person's experience with lymphoma can be different, so personalized medical advice from healthcare professionals is essential.